years of experience in this sector who are going to be speaking throughout today.
What I'm really excited about today is meeting and hearing from our Mission Zero community champions.
Today has been absolutely fantastic and I've really enjoyed myself and feel very privileged to be part of it.
It was really exciting.
Inclusive, come together, share your knowledge, share the experience.
It's brilliant.
The key themes of Mission Zero are trying to reduce new transmissions of hepatitis C, HIV and TB.
The fight to get to Mission Zero by 2030 is not something we can do in isolation. It requires collaboration and cooperation. It means partnerships between local authorities, HIV organisations, LGBT+ groups and many, many others. Particularly, we need to reach out to hard to get to communities to ensure that those people get to Mission Zero as well.
Partnership is really important in order to have a coordinated approach to managing and identifying infections and to get a greater reach of people that you wouldn't normally get otherwise.
Working in partnerships for the 2030 targets is incredibly important. It has been in my role. I generally share a lot of clients with other organisations. It has made pathways easier and more accessible to have everybody on board coming and doing all the different testing, simply because if you've got different events going on, people get testing fatigue.
We really need to be able to work together to find people and be on the same page.
From doing this testing, with 24% of the patients we've seen have tested positive for latent TB. They then come on to us, which means we then test them for HIV as well and hepatitis, so it's just been great.
I think that's a really interesting point, just in terms of, I suppose, asking the panel how they think Mission Zero has helped partnerships.
It's been extraordinary seeing how we've developed. We have come leaps and bounds from where we were back in the day. And I'm really pleased to say that when we actually go out into the community and test people in the community, the nurses are one call away and they're extremely engaging. So yeah, we've come a long way.
I think it's great for us as organisations because we share resources. But I think it's also good for our service users that we can offer a holistic approach. People, for whatever reason, and there's lots of reasons, won't go to a clinic, they're scared of home tests, so I think it's imperative that we do get out there and reach communities.
Supported various testing sessions, prep training that Anna's organised in Calderdale and Huddersfield. And so she approached me and asked me, do you want to be part of the Calderdale Champion Mission Zero? And I said, yes. So I joined. We'll carry on creating awareness within our community of how important it is to be tested.
What you need to do is employ more people from those communities, get the languages out there as well, so people with language skills.
We know that when people get tested, we're much more likely to be able to identify HIV, get early treatment, which will not only save lives, but will also help stop the spread of HIV.
There's lots of support available regarding testing. So there's the standard support that you get through normal health services, through, for example, sexual health, but there's also support through the Hepatitis C Trust, the Outreach TB service, and also through the Brunswick Centre as well.
It's impossible for me, as somebody living with HIV, with an undetectable viral load, to pass the virus on. And there's a really important message there about the public health imperative of making sure people are tested, get to know their status, get onto treatment, because if they're on treatment and have an undetectable viral load, it's impossible for the virus to be passed on. And that's one of the key tools in the toolbox to end new cases of HIV by 2030.
It's good to test, good to know if you're negative, the things we can do to keep you negative, either through vaccinations or preventative treatment. If you're positive, there's treatments available. Treatment for HIV is excellent these days, so it's now considered a long-term medical condition, so that people can live a near normal lifetime. There's also treatments available if someone is negative in order to remain negative with pre-exposure prophylaxis. TB therapy is very effective. We do have issues with resistance to it, so it's really important that people are able to take the medication consistently. And Hep C is now curable with the advent of the new agents, and that's happened in the last few years, so much more positive outlook than in the past.
Many people, as they talk about their journey with HIV, will often talk about shame and a lot about the discrimination that they fear because of their HIV status.
Stigma that comes with hepatitis C, HIV, TB, STIs, it stops people accessing services. it affects their mental health, it stops them just living life fully.
I want to emphasise the importance of psychological support for people living and infected by HIV and other bloodborne viruses. It's so important. There is wraparound support for people, and that people feel they've got the support that they need in order to take the next step in their journey.
If there's anybody in the panel, please could just talk about how services have really helped them in terms of health and well-being.
I came from being a drug addict for 30 years to having an incredible role helping and saving the lives of other people. When I met John came to support me into treatment for hepatitis C. He was kind of, he treated me like I was a person. It kind of made me feel like I was more than just the illness that I had. And yes, that was incredible.
Lived experience is so important. Talking about something that's actually happened to you, how you've experienced it, how you've combated stigma.
It's a precious thing for someone to have the confidence to share their story so that somebody else can feel comfortable to hear the messages and then feel okay to go and get tested and access treatment.
I think it's co-production. Co-production was a true sense. Looking after people with warning and training them to take part with lived experience and hearing their voice.
What can we do to help create the space and the opportunity for those stories to be heard?
I think for me, getting them stories out there is about creating events and groups like this.
Share your own stories and to listen to others.
This partnership has really worked, and it needs to continue.
I found it really inspiring coming from a different local authority, seeing the amazing work being done over here.
We're all on the same path and we're all trying to work together.
A big ambition, but it's absolutely doable.
Today's conference was about local organising, about grassroots self-help and volunteering, about education and support.
It's a goal across the country, but actually this is the first time I've seen it actually on the ground working. It's incredible.